I am Meredith, and I'm now 29 weeks, and am about to go for a growth study on our son. And I heard that the growth study is for them to check to make sure that Tillman, our son, is growing as he should, based on measures that they have predetermined, and to see whether he has grown since our last ultrasound, which was about 2 months ago. So we should find out, and the reason why I'm having that done is because my belly growth, for lack of a better term, is not growing. It seems to be about 2 weeks behind. So they just want to check and make sure that he's growing as he should.
This is baby's belly.
What is, like, kind of those holes or whatever?
One second, I'll show you. One here is baby's stomach, and this is the umbilical vein here. Spine on this side. Those are all normal. I'm going to take a couple measurements of the belly. Just measure a little bit on the smaller side. This is the leg bone, the thigh bone.
That's measuring on target.
A little bit on the shorter side, but still within the normal limits.
Well, I'm not helping him out. 5'2" on a good day.
Nothing wrong with that. Kind of got the face up in the placenta up here. Just a little mouse.
Mm-hmm.
Looking in the brain here. The lateral ventricle here. Looks normal. Come on, baby. So this cloudiness here is the placenta that I'm trying to go through.
Oh, okay.
So puts baby at the 31st percentile. So
The higher the percentile, the better, right?
not necessarily. I mean,
average?
we want it 50. That's
Okay.
like right smack dab in the middle. That's average. So baby's a little bit on the smaller side, but still completely normal. You don't want them too big either. I like the unique ones.
So when he's breathing, he's actually just sucking in fluid?
Mm-hmm. Beautiful. So those are completely normal.
Baby looked good on the ultrasound. Dr. Viller's concern was that the growth of the baby, or the fundal height measurement, felt a little less than it should. She thought it should.
Right.
Looking at your baby, doing kind of an overall assessment of growth, the growth is in the normal range. We plot a baby, we do a composite of measurements and then plot them, and your baby comes out, I think, at like the 27th percentile. Less than average, but perfectly normal.
Okay.
The baby's abdomen, which is just one of the measurements, is a little bit small, and that's associated with a growth, with growth problems. But then again, the abdomen is the hardest structure to measure because it's not solid like a bone; it's compressible. So you can measure abdomens, and sometimes they'll be underestimated. So basically, all I'd really recommend is that you just have another ultrasound in about a month to check on the growth again.
All right.
What was the overall growth? 2 pounds?
2 pounds 8 ounces.
2 pounds 8 ounces, which is in the normal range, as I said.
There's nothing I can do personally to help this growth or anything.
Take good care of yourself.
Okay.
Eat well.
Yeah.
Gain appropriate amount of weight. First of all, your baby's probably the size it's supposed to be, so there's nothing really to do.
Okay.
I mean, your baby's in the normal range, and how big the baby is mostly genetically determined. So this may be just exactly the size the baby's supposed to be, because it's not really abnormal. On the other hand, if there is a problem, it'll show up, as we continue to follow, which is why we're recommending a follow-up scan in a month.